Hey, welcome back to the Movement Multiverse podcast, the podcast that talks movement way beyond muscles and mechanics, but sometimes doesn't. Join Max as he explores how movement shows up in our bodies, screens, cities, stories, emotions, and more. If you're a movement nerd like me or are just diving into the topic, this is your universe. Just a disclaimer before the episode starts, episodes are not intended to treat any individual's medical problems. These are just for education and entertainment purposes only. Thanks for tuning back in to episode 2 of the Movement Multiverse. Today we are discussing Ted Lasso's solution to back pain. But before we start, I just want to introduce myself. My name is Max. I will be your host. I am currently a third year, so I'm in my final year of physical therapy school. I have my undergraduate degree in kinesiology. I was a personal trainer for a few years, and I'm getting ready to graduate. So very much involved in the movement world. I really enjoy everything related to it, including exercise. Just to start off with a cool quote that I saw: "Life is like a bicycle. To keep your balance, you must keep moving." That was by a pretty smart guy, Albert Einstein, and I think that will set the tone for the rest of the episode. So let's just give a quick summary of what the episode is going to be about. We've already mentioned Ted Lasso. That'll come in a little bit later. But we're also talking about back pain. And back pain is everywhere. There's a lot of differences in how back pain might present. We'll also talk about how Ted Lasso comes in and how maybe some of his coaching techniques and just him as a person can change how our back pain outcomes change. And then we'll see how we can emulate Ted Lasso when we deal with back pain. And then what we can do either to make it get better or what we can do if it doesn't get better. All right, so let's get started. So besides movement, one of the things that I enjoy doing is making a list of all the TV shows and films that I've seen. This kind of started in college as I got more into movies and TV shows, especially during COVID. So Ted Lasso is actually one of the top TV shows that I have in my list. I gave it a 9.5 out of 10. So I only have, I think, 2 shows that are 10 out of 10. So those are Breaking Bad and Game of Thrones. Ted Lasso is just under at 9.5 out of 10. So if you haven't seen Ted Lasso, highly recommend. I think season 4 is coming out next year, so that'll be, I hope good. Something Ted Lasso said that I think will play into what we're talking about throughout this episode is be a goldfish. So what he meant by that was forget about your past, forget about the things that don't matter, and let's move forward. So when we're talking about back pain, I think forgetting about what you already have heard about back pain or maybe what you see online is going to be important in absorbing the information that we're going to talk about today. But something also that Ted Lasso talked about was believing. So he put up a sign in the locker room that said believe, and that'll also come into play when we're talking about most of our conditions with back pain. So back pain is super prevalent. Almost 80 to 90% of the population will experience some sort of back pain. About 90% of the people with back pain will get something called non-specific back pain. And that just means we can't identify a specific cause of it. So there's no underlying condition that is causing the back pain. But as a physical therapist, something we're looking at is what happened when it first started, how long has it been happening, was there a specific movement that caused the back pain to get worse? What makes it feel better? But interestingly, back pain is actually most prevalent among 20 and 50-year-olds. So maybe one of the myths that you've heard is back pain is mostly within the older population. So maybe someone above 50, 60, 80 years old. And that's just not true. So let's kind of hit on some of the common beliefs and myths that we'll touch on throughout the episode. So a lot of people, when they have back pain, they believe that their back is weak. And that's just not true. The spine is one of the most sturdy, stable parts of the body. It absorbs a ton of force, especially during just daily activities like walking, standing, maybe if you're an athlete, running, twisting, jumping. It absorbs a ton of force. So it's super sturdy. It's a solid structure. Of course, there are some serious pathologies, maybe like a slipped vertebrae, but those are pretty rare. Again, 90% of back pain is nonspecific and can be fixed with most of the time non-surgical intervention. So another myth, herniated discs means you cannot lift. People, when they hear the word herniated disc, often get afraid or are fearful of movement just from hearing the word alone. And what a lot of evidence suggests is that herniated disc, just because you have one, doesn't mean you can't do activities of daily living. It doesn't mean you can't exercise. It doesn't mean you can't do your hobbies. In fact, it suggests the opposite. You should be lifting. You should be doing the things that you enjoy. Of course, there are some cases where maybe a surgery is warranted, and we'll talk about when that might be warranted. But for most of us, it's not. And we can do things to get better, and we don't actually need to be fearful of it. Another myth. Nothing has helped me thus far. I've tried the chiropractor, I've tried physical therapy, I've tried my doctor, and nothing has helped it thus far. So movement definitely won't help. Again, not true. Age makes my back weaker. Again, we talked about this earlier. The highest incidence of back pain is actually between 20 and 50 years old. So if we think why, maybe there's more exercisers, so there's more strains. But overall, exercise is a super safe intervention for back pain. There's just incidences of maybe poor form or going too high on a weight that shouldn't have been done quite yet. But for the most part, back pain kind of lives in that middle-aged area. Another myth, I probably have a serious problem if I have back pain. 90% of back pain is nonspecific, meaning things like fractures or degenerative diseases that are causing the pain are pretty rare. Very small percentages of people with back pain actually have a serious problem. Another myth, pain equals something is broken or damaged. So pain's a really interesting topic on its own. There's a lot of new science and theories that kind of talk about how pain is pretty much a construct within the brain, and it doesn't have to relate to any damaged or broken tissue. So some studies will show that people without pain actually have a high percentage of quote unquote damaged tissues, but they're not experiencing pain. And then people with pain kind of will have a 50-50 split of if they actually have damaged tissue or not. So pain does not equal something being damaged or broken. And then the last myth, your posture caused your low back pain. Posture is, again, one of those nuanced topics that can definitely be talked about on its own. But when we're talking about back pain, posture is more related to not moving rather than a specific posture. So just a quick tip, if you're thinking your posture is bad, one way you can improve your pain, if you think it's related, is to change position every 20 to 30 minutes. So instead of staying in one posture, whether it's perfectly upright or slouched, changing that position frequently will actually be better for your back pain than changing the specific posture. So we've talked about some myths. We talked about some facts about low back pain. We talked a little bit about Ted Lasso. Let's talk about some things that happen in today's either medical field or physical therapy fields related to back pain. So again, we mentioned chiropractors, we mentioned physical therapists, we mentioned surgeons, and some of the language that you hear, especially related to back pain, is it's the worst back they've ever seen. You should not be bending, lifting, or twisting. And this sort of language isn't really supported by evidence. It also induces fear, and it induces further problems. So if you are going to a provider that says things like these, I would second guess their opinion. So what does back pain mean? So if we're trying to figure out if you have that non-specific low back pain that could be fixed with things like exercise or diet without surgery, how can I tell? What sort of things could I ask my provider if I end up needing to go to one? And then how do I know which kind of back pain I have without going to any of those? So let's start there. let's start with that non-specific low back pain. But first, we need to talk about red flags. So when we say a red flag, it's something that is enticing us to a more serious pathology. So things like a whole body fever, an incidence where a fracture could be likely, like a motor vehicle accident or a hard fall. We're also looking for things like unexpected weight loss, so something related to cancer. And then other red flags like, have you had a history of cancer? Do you have a history of autoimmune diseases? Do you have a history that might progress or accelerate degenerative diseases? So, and then we're also looking at radicular symptoms. So what that means is the tingling, or is the sensation, or is our motor control getting worse? So is it progressing to the point where our body systems are also changing? So those are all red flags that would make you go to either your physician or potentially a surgeon. I would also go to a physical therapist to evaluate your need for more care. But that's just the scary stuff. Again, that's a pretty small percentage of back pain. Let's go back to the 90%. This is your mechanical. It means your pain changes with position. It changes throughout the day. Maybe if you're sitting, it hurts more. If you're standing, it hurts less. While you're moving, it gets better. And then maybe when you get up in the morning, it's a little bit worse. So that mechanical, non-specific back pain, it's non-progressing neurological symptoms. Again, non-progressing. And then maybe there's more a chronic sensitivity related to that back pain. So maybe we had an acute strain while we were exercising, or we picked up something weird and then we just never got it checked out, kind of rested for a bit, hoping it would go away, but it's still lagging around. So once we're dealing with that chronic low back pain, it's more of a sensitivity problem rather than a tissue damage problem. So everything I just mentioned can be hopefully worked on with our non-surgical interventions. So things a provider, a medical provider, might be listening for when they hear of non-specific low back pain is, I threw my back out, or I picked up something weird, or I was exercising and all of a sudden I felt my back kind of like give out. So all those things kind of give us clues as to what's happening underneath. And speaking of underneath the tissue, a lot of times we're thinking of imaging. So should we get an X-ray? Should we get an MRI? Should we get a CT scan? And what some of the evidence shows is that when we get an MRI, a CT scan, it's going to show that we have problems, no matter if we have pain or if we don't have pain. So if it's showing that we have a tissue damage, quote unquote, then patients are more likely to believe they need surgical intervention to fix the problem. But as we talked about earlier, just because there is pain doesn't mean there's damaged tissue. And just because there's damaged tissue doesn't mean there's pain. So when we get imaging, it's more fear-inducing. So what we should do, and what I recommend, is that we wait to get those images done to find out if surgery is warranted. So how long do we wait until we actually need to do that? Some will say around 3 to 10 months of non-surgical intervention, so like things like physical therapy or general exercise, and seeing if the pain changes, if it's progressing. And then from there, if it hasn't changed, then we try things like imaging and surgery. So during that 3 to 10 months, what should we be doing? So the first step, let's go back to Ted Lasso. So Ted Lasso, I'll give you a quick background. He was hired as the coach for a soccer team after they had had a pretty bad season, or a couple bad seasons, and they really needed a big change. So Ted Lasso came in with really not much professional coaching experience and completely turned the team around. They didn't win a ton of games at first, but he turned around the culture. So when we mentioned belief systems, we mentioned forgetting about our previous beliefs and taking on new beliefs. So he changed the language within the locker room. And we're talking about low back pain. We need to change the language within our head while we're telling ourselves about the back pain. So maybe our current or our past beliefs we're saying things like we need to rest, we should just ice it or heat it, give it a little bit of compression, maybe elevate. So that rice method, maybe we need to stay away from lifting heavy or lifting at all. I need to stop exercising. And then I need to stop doing the activity that hurt my back. And that is outdated. It doesn't help anybody, and it just leads to more problems. So a lot of the language was things like stop doing the things you like to do, rest. And for low back pain, for our non-specific low back pain, it's just not the best method. So Ted Lasso introduces a new method. So it's more of that psychological component of back pain. And it's kind of a two-step process, right? So step one is that psychological component, which we're going to talk about in relation to Ted Lasso. And then step two is that mechanical component. So exercise plus our belief system is hopefully it's what's going to get us better. So back to Ted Lasso, he came in and changed the belief system of the team. He put up a belief sign. It just said believe in the locker room. And kind of the idea behind that is when things are at their worst, he asked the team to believe in a better outcome despite constant losing and fear. And then without a change in belief, he thought that none of the mechanical work they did in practice would actually make any change. So they could do all the things in practice to get better, but without the belief that they would be better, it doesn't matter. So we need those two steps to get better, especially when we're dealing with low back pain. There was also a scene in Ted Lasso where he had a conversation, I think it was with the team owner or another team coach, I can't remember, but he was kind of talking about how the other coach believed Ted Lasso thought he was incompetent. He would never reach the goals that he aspired to, so the other guy thought Ted Lasso would never be able to improve the team from his previous experience, from his methods of coaching. So when we're going back to, or when we're relating to low back pain, that idea of fear-based or assumption-based behavior, so believing those myths, believing the things we see online, being motivated by fear versus curiosity-driven behavior, so things like positive belief systems and improving our back, and then believing with gradual exposure to things like exercise or changes in diet or any other non-surgical interventions, we could actually get better. So let's talk about that mechanical component. So we started to change our belief system the way Ted Lasso teaches us, right? We need to believe that we can get better, even though despite our beliefs, we think we might not. So we can do things like bending, lifting, twisting. We can do things like the things we were told to stop doing. But now how do we actually do it? So step two, that mechanical component. So graded movement, this is kind of where either a physical therapist steps in and can really help us guide us to the right spot. And what we're doing is we're looking at, depending on the state of the pain, is it more of a sensitivity problem or is it really damage to the tissue? And a lot of times when we're talking about chronic low back pain, it's more of a sensitivity problem. So our brain does not like the things that we do, even though the tissue is ready to do it. So graded movement more aligns our brain to allow us to do the certain movements that maybe we're fearful of or use our back a little bit. But those things are what help us to become accustomed to getting us back to what we want to do. So starting small and getting big with our exercises and movement. So a really simple way to get started is by doing a walking progression. So a lot of times people with chronic low back pain either are dealing with something like obesity, are dealing with things like physical inactivity, and walking is a great way to not only increase blood flow to the area, but to get us up and moving, get us more active and in routine to prepare us for more exercise. So really great way, once we started doing the walking progressions, is to include some body weight endurance movements. So things like planks, things like push-ups, like static crunches, pull-ups, things like that. So things where our back is involved, but our whole body is working together during an exercise. So it's pretty interesting. Our brain is intricately connected to our muscular system. And when we change our beliefs and we add the mechanical progressions to exercise, our muscles often respond positively to changing the pain response. So we've come to the point where we've changed our belief system. We're saying we can do things like lifting and exercise. What else should we incorporate into our routine with the exercise and our belief system? So if there's an acronym called MEDS, MEDS, and it's not medications, it's mindfulness, exercise, diet, sleep, and stress. So MEDS, it's a super simple acronym that we can remember that steers us to more lifestyle-related intervention rather than things like medication or surgery that often has a super big impact on how we experience low back pain. So maybe things haven't changed. We've tried the 3 to 10 months of MEDS, so MEDS. We've tried physical activity interventions like walking, body weight endurance movements. We've tried physical therapy. What do we do now? So at this point, maybe we start getting referrals for maybe a physician or a surgeon, but we need to know what the right questions to ask them are. So I wrote down a couple of questions that if you do have low back pain and it's not changing, or maybe it's progressing into some of those neurological symptoms, or maybe you're having some of those red flags, these questions can help decide if surgery is maybe a good option. So how does this treatment relate to the findings in your examination? So say you went to physical therapy or the surgeon, ask them what they found and what it actually means. Is this treatment matching the demands of my work, hobbies, or daily activities? So is what you're doing actually going to make a difference in the things that you want to get back to doing? So whether that be surgery or physical therapy. If surgery is presented as an option, ask some of these questions. What outcomes have you seen from patients with similar conditions in relation to pain and return to activity? What risks are related to this surgery? How does this surgery compare to non-surgical interventions for my specific problem? And then what does recovery actually look like? So a good surgeon, a good physician, a good physical therapist can answer these questions with evidence-backed explanations, and ultimately they leave the decision up to you. They're not going to force any sort of intervention on you. If they do, I would be skeptical. So if a surgeon says you absolutely need this surgery, I would get a second opinion. What they should be doing is presenting options. So describing what would happen if you went with the surgery versus non-surgery, or maybe options of surgeries. So at the end of the day, the surgeon or any provider should be able to answer these questions and provide you with the information you need to make an informed decision. So we've kind of walked through how back pain really sucks and how we can take certain steps to improve it on our own. And then if it doesn't improve, what we should be looking for and when a referral is warranted for a physician or a surgeon. Back pain really does affect a lot of us. Again, 80 to 90% of us will experience some sort of back pain, either from simple sprains all the way, from needing surgery. So there are things that we can do to change our outcomes, our belief systems, our lifestyle changes. So the MEDS acronym, and then simple things like asking the right questions of our providers to make sure our medical care is top quality. So that brings us to the end of the episode. If you enjoyed the episode, please follow, comment any questions or maybe thoughts you had about the episode. And then if you know someone with back pain, send this to them and see if it helps. So next episode, we'll be talking about why NASA bets big on movement. Thanks for tuning in, and see you next time.